Hello, it's Bruce Williams again, and today I'm thrilled to begin my series on the selected gross pathology of the musculoskeletal system. Recently I had a musculoskeletal problem of my own, and today will be my first time doing a lecture since I had my Achilles tendon, which got ruptured, repaired about 2 weeks ago. I took a selfie so you could see what the injury looks like. Wait, no, that's not me. That's a great picture of an Achilles tendon rupture in a dairy cow by Dr. Ricardo Mendez, and we're going to talk about gastrocnemius tendon ruptures when we get to the section on traumatic injuries of the musculoskeletal system. No, that's me. That's about 3 days post-op. They put this big yes on my leg because they were very concerned about operating on the correct leg. So I guess I appreciate that. And then my doctor signed it. And you can see 3 days post-op, there's a whole lot of bruising. If you want to know what they do, they go ahead and they pull the tendon off the back of your heel. They take out the devitalized tendon, they screw the whole thing back in, and then up here around the calf muscle they go in and they do a Z-plasty, which helps to lengthen the tendon and prevent re-rupture. It's not a whole lot of fun and nothing that I recommend. So if you have chronic heel pain or chronic ankle pain, make the time to go to your foot or ankle doctor and get it checked out because you don't want to see it get ruptured. Here I am about day 7 with my crack nursing team, one of which I found asleep on the job. So I'm 2 weeks out and I'm ready to get back to work. And so today we're going to talk about degenerative diseases of bone. But before we do that, like I always do, I want to thank my friends and colleagues who have provided images over the years, either directly or through online collections, which allow me to make these lectures available. Okay, before we start on the degenerative diseases, I want to show just a couple things I found along the way collecting these slides, which are actually normal features. And this is my own cat, Smeagol. If you look closely, she has some craniofacial abnormalities, which are not abnormal with Burmese or the Bombay breed, of which she is. She has the typical breed-specific flattened face, but the reason I got her is she's not much of an athlete. You can see that her little nose has been twisted about 20 degrees counterclockwise. But she does fine. Okay, a couple things that you will see along the way. I just threw them in here because they're not pathologic findings, but they do affect the musculoskeletal system, and this is your typical produced broiler chicken. Notice that, very common in poultry, the beak is somewhat deformed, it doesn't have that normal point because what they do to prevent injuries, chickens and turkeys peck at everything. They'll peck at each other if they see a bit of vent or a little bit of blood. So what they do is they take a hot soldering iron first day and they just cut off the pointy part of the beak. It doesn't prevent the animal from taking in food. You do have maybe a less than 1% problem with the beak being cut off abnormally, unevenly, maybe too short on the top or too short overall, which causes problems with eating. But it's a commonly used practice, and it will save the producer down the road a lot of money in traumatic injuries. Here's an abnormal bone that some of you may not have ever seen. It's a triangular bone known as the os cordis, most commonly seen in cattle, and you see it at the junction between the atrium and the ventricle. When animals have large, heavy hearts, cattle, and even higher, I'm sure that elephants and large cetaceans have them as well. They need a little extra support to make sure that the heart doesn't collapse on itself, that the electrical system functions properly, and so these animals have evolved this little bit of bone within the heart known as the os for bone, cordis for heart. Most of you know that a number of animal species, including the raccoon as seen here, the dog, the walrus, and other species, have a bone in the penis. The penis is not totally composed of cavernous erectile tissue as it is in most species. And this is known as the os penis. It can be fractured like any other bone, which will cause problems. This is the typical shape for a raccoon. This one's a little yellow because the raccoon was icteric. Normally they're bright white. In the walrus, in Native American culture, they are often used, the baculum or os penis is called the usic, and it is often used for ceremonial carvings. They do absolutely beautiful artwork with this bone. Okay, another not abnormal, but something that you will see occasionally in swine over 3 years of age are little bones at the root of the mesentery. This is just ectopic ossification, and the cause of these little bony spicules which radiate through the mesentery isn't known, and they're not considered of any significance, but you can collect them, have a nice collection like this collection from Dr. John King. Okay. Has anyone ever asked you to identify a skull, whether it is a sheep or a goat? Me neither. But in case anyone does, here's some nice stuff from John King's collection, which will help you to tell whether you're looking at a sheep skull or a goat skull. Sheep have straight sutures in the cranium, as opposed to goat skulls, which are brightly colored red and yellow. No, that's not true. Somebody painted this particular one. But you can see that they do have the natural curvature that we expect with sutures in most species. So sheep are straight, goats are typical curvy. Something else about the sheep skeleton is there's no curve to their scapula. I don't know why that happens, but they're like little isosceles triangles. So you tend to have the typical curve that you expect to the wings of the scapula when you're dealing with the goat skeleton. And one more is that goats have no infraorbital fossa in front of their eye. So if anyone ever asks you to make that identification, hopefully this will be somewhat helpful for you. Okay, let's move on to true developmental diseases. And if you're interested in congenital diseases of bone, I will recommend a wonderful and short paper in the Journal of Veterinary Diagnostic Investigation that was published in 2015 by Drs. Karen Dittmer and Keith McDonough. Let me correct myself. Dr. Keith Thompson. That's the problem with being a couple weeks out of practice. Okay, so Drs. Dittmer and Thompson from Massey University, where a lot of wonderful orthopedic diseases have been identified, including spider lamb disease, did a great review of how to investigate these. And there are three ways that congenital disease arises in bone. Okay, one, as you can imagine, is genetic. And we're going to look at a couple of these, like spider lamb itself, which is a mutation in the receptor for the fibroblast growth factor. Something else that will affect the developing bone in utero are teratogens, like false hellebore or Veratrum californicum. And we're going to look at those in the section on toxic insults to bone. And then the third thing, which probably few people will think about, is nutritional deficiencies in utero, especially trace elements like zinc or manganese may cause developmental abnormalities that look very much like the teratogenic or genetic mutations that we see. Now, what is a lecture without putting a cyclops in? if you're going to talk about developmental abnormalities, musculoskeletal system, you have to throw that in. As we said before, we're going to talk about it in depth, but this is a pig, and we tend to think of animals, primarily ruminants, as developing synophthalmos, the proper name for cyclopia, as a result of ingestion of cyclopamine or the toxic principle of Veratrum californicum, somewhere between 12 to 16 days of gestation. But this is a pig. This animal had no access to false hellebore or Veratrum. And this points out that this can be a spontaneous lesion in any species up to and including man. It has to do with the underexpression of the sonic hedgehog gene, which causes the separation of the developing fetus into two equal longitudinal halves. There's going to be a lot of other problems associated with this particular animal besides just having two fused eyes in an orbit. You can see there are significant craniofacial abnormalities. The nose or the proboscis is situated on the head, and if you've reviewed the lectures on the nervous system, you'll know that not ready for that one yet, that the brain will not split into two halves, resulting in one large cerebrum called holoprosencephaly. So this is synophthalmos, cyclopia. It's not always due to plant toxins. Now, sometimes the sonic hedgehog gene or related genes will be overexpressed, and you'll get splitting where you're not supposed to get splitting, and this gives us a condition known as, among other conditions, diprosopis, or two faces. These cats are called Janus cats, and believe it or not, they can live for a long time. This particular cat lived for 15 years. Okay, did all of its eating through this mouth here. This mouth was poorly formed and had a rudimentary esophagus, but the animal got through life, amazing as it is, by using this part of its face. I have no idea how it saw with its eyes so far set apart, but believe it or not, these animals can survive for significant parts of time. Obviously, it's not always a fatal event, and these animals require loving care from their owners. Okay, there will be a lot of congenital abnormalities where we end up with not enough of something or too much of something. This goes for the musculoskeletal system as it goes for every other system, and we end up with animals like this that have no legs, or maybe parts of legs, or not enough legs. Okay, this is known as Heme Amelia. It is a documented, inherited, lethal, nobody wants a calf with no legs, defect in certain breeds of cattle like Galloway. Usually these syndromes are multifactorial, including hereditary factors, environmental factors, and maybe even both. In humans, some of the genes associated with these conditions have been identified, but not yet in cattle. Obviously, the homeobox genes, like sonic hedgehog, probably have something to do with it. And recently, a mutation of the Wnt3 gene was shown to cause tetraamelia. Here's Amelia in a litter of pigs. And a couple of commonly used antibiotics, including albendazole and fenbendazole, have been shown to cause significant limb and digit abnormalities in pigs as well. Here's a Holstein who thinks it's a velociraptor. And we have a case of Heme Amelia in this particular animal. Sometimes you have too many. I don't want to sort all this out, but there's like two animals, so conjoined twins with 8 legs. Who knows what's going on in here, and there are lots of great pictures out there of monsters which have deformed skeletons. They're very popular at sideshow carnivals as well. Believe it or not, sometimes we are responsible for breeding these into the lines. This is a Dexter calf, and people, it's a Dexter cow, and people love these little cows. They buy these little, 1 acre farms, and they need little cows to populate their little farm. So Dexters and other small breeds of cattle have been developed, including the Wagyu Dexter crosses, the belted Galloway Dexter cross. Remember, we just talked about Galloways having Heme Amelia or Amelia, so that sounds like a bad condition. Also, a cross with Herefords called Kenshires. People love these little foreshortened leg cattle. But there are a lot of other abnormalities that you will see that the Dexter people know about and have gotten into pathology literature. The Dexter bulldog calf is an abnormality of the musculoskeletal system, which may be seen in up to 25% of offsprings in some lines of the Dexters. The Dexters generally do not survive. They are stillborn. They have profound craniofacial abnormalities with brachygnathia, prognathia, a domed head. Their legs are twisted, and you can see that the face of this young calf is so crammed that it can't even get its tongue out. And that's sort of characteristic of these animals when they're born. Their tongues are sticking out because they're too big for their mouths. The Dexter bulldog calf. Here's another Dexter bulldog. This might not be a Dexter. It actually may be a snorter, which means that it possibly lived for a particular amount of time. There's another variation of this called telemarks. These are usually Angus cattle which die of suffocation shortly after birth. Look, they all have that domed head and that really foreshortened snout. The bulldogs are the homozygous animals with all of the genetic requirements to create the bulldog calf. We didn't look at the legs, but you can see that the legs on these animals have these tremendous flared mushroom-shaped epiphyses, odd-looking articular cartilage here. It's greatly shortened from top to bottom, but most of these animals, or all of these animals, generally do not make it through the perinatal period. Here's a snorter. This one obviously lived through for weeks. They can have other abnormalities. They can have changes in the limbs. You can see that this animal also has a short snout with a shortened maxilla. They're called snorters because of the respiratory difficulties that they have. And as I've always said before, when you see one congenital defect, look for other congenital defects. A lot of these animals are born with large inguinal hernias, or abdominal hernias. You can find just about anything in them, but they're named because of their musculoskeletal defects. Bloaters. This is a young Hereford. It is short in stature. It has short legs, and it's a dwarf. And one thing that affects a lot of these animals is chronic bloat. And nobody's really established why these animals bloat so often, but it is associated with the dwarf Herefords. And Dr. John King and I present this because I think it's an interesting finding. Often when he had these dwarfed animals that would come in for chronic bloat, would examine the inside of the cranium. And he found that the inward projection of the wings of the orbitosphenoid bone is very common. He would call these bloat bones. You don't see a lot about that in the literature, but it was a finding that he made on a fairly consistent basis. So if you ever come across one of these dwarf bloating animals, make sure you check the inside of the cranium for the bloat bones. Does it have anything to do with the condition? I don't know. Okay, not every craniofacial abnormality, even the severe ones, are life-threatening. Here's a dog with tremendous brachygnathia of the maxillary. His name was Stephen because of how he talked. It is one of the most, brachygnathia inferior is one of the most commonly encountered musculoskeletal abnormalities in dogs and many other species. Don't forget, any of these conditions may be associated with other skeletal defects. Okay, here is a beautiful congenital defect which has been referred to as marble bone disease. But what I want you to see are these large triangles or pyramids of unremodeled bone which extend down into the diaphysis, leaving almost no bone marrow space. The true name of the condition is osteopetrosis, and you will hear about osteopetrosis both in mammals and in birds, but we're going to cover the bird osteopetrosis when we get to viral disease, but it is caused by a retrovirus. Osteopetrosis in mammals is not virally induced. It's a congenital problem that, at least in the Angus, has been associated with a deletion mutation in the bovine SLC4A2 gene. This causes osteoclast defects, and the osteoclasts in these animals are not able to obtain the proper acidic environment at the ruffled border for them to be able to remodel bone in the developing fetus. So that growth plate just grows and grows and grows and is never remodeled. And when you look at the long bones, even the flat bones, they're almost solid bone. These animals aren't, they're not tanks. They don't survive. Okay? You see very shortened bones because they don't remodel or lengthen in the long bones. In the flat bones, you will see brachygnathia inferior again, and there will be no eruption of the cheek teeth in these animals because that bone is so solid it can't be remodeled, so you don't see cheek. Because of the brachygnathia, these animals often have the protruding tongue, dome-shaped faces. A lot of the congenital abnormalities look alike, but if you know that this is a red Angus, this is one that you want to suspect. And these bones are extremely brittle and break easily, although you'd think you couldn't break them because of all that bone, but it's unremodeled bone, mostly cartilage, and so they snap very easily. This condition is also seen in horses. Look, once again, we have the two pyramids of bone, very solid along the area, and the cortex of lamellar bone is also very thin because it doesn't get remodeled either. This is rarely seen in horses, occasionally in Peruvian Pasofino horses, and rarely in Appaloosa. Because there is no bone marrow in the bones, these animals are usually severely anemic as well. Now, there are a lot of conditions which we're going to talk about in this lecture series which cause decreased production of bone. In those particular cases, a lot of which are nutritional. the bone that is made is decreased in quantity but not in quality. It's normal bone, just you have a lot less, resulting in osteopenia and osteoporosis. There is only one condition that results in a decreased quantity and quality of bone that is seen in a number of species. We're looking at the costal plates of a cat with a normal control on the left and an abnormal on the right. The condition is known as Osteogenesis Imperfecta. It's seen in dogs and cats. Obviously, it's seen in people, a wide range of ruminant species and breeds, including in cattle, Holsteins, and Charolais, in a number of different types of sheep. And this is due to mutations that have been identified in humans of the COLA1 and COLA2 gene, resulting in defective osteoblastic production of type 1 collagen and osteonectin. Okay, mild forms and heterozygotes result in normal collagen in reduced amounts, so the bones will be somewhat brittle. Severe forms result in defective collagen type 1 and a decrease in osteonectin, which prevents the cross-linking of collagen. So these bones break very quickly. One of the reasons that you can tell that, you know, some of these bones have multiple breaks in them. This might have been due to, this might be a young kitten, and we're looking, and usually they are when you find them, and multiple breaks as a result of parturition itself. This is from another cat, and you can see several breaks here in the femur and possibly in the tibia as well. This is a Romney sheep, same thing. Newborn animals often will present with multiple rib fractures from simply passing through the birth canal and the damage done by uterine contractions. Possibly the mother may sit or step on them, resulting in additional traumatic injuries, but the lesion is due to that genetic mutation. Okay, here's a classic fetal monster known as a schistosoma reflexus, seen in ruminants, and they all pretty much have the same thing, significant spinal defects. But like so many other animals, you can see a protruding tongue, brachygnathia superior here. But the thing with these animals is that they have a large defect in their abdomen, resulting in eventration. And if you look at the positioning of the legs, they have such severe scoliosis that their back legs actually flip around and they turn up dorsal to the front legs. So schistosoma reflexus. Now let's talk for a little bit about a condition known as Arthrogryposis. Some people call it crooked calf syndrome. That's something that is a little different. But arthrogryposis is the abnormal positioning of generally the legs, sometimes the spine in an animal that is just born. Obviously, these are not really consistent with life. The muscles of the front and hind legs are often markedly atrophied and fibrotic, and the legs are locked into an abnormal position. There are a number of conditions that can result in arthrogryposis. A lot of the cases, and we're going to cover this again in a subsequent lecture, are the result of viral infection of the central nervous system, especially the spinal cord. Remember that for muscle development and muscle function, you have to have innervation. And if the spinal cord and the motor neurons which go to the legs have been damaged by viral infection during development, you will get these very abnormal positioning of the legs. This is often seen with the Bunya viruses, such as Cache Valley virus here in the United States, Akabani and Aino virus in Japan, and now Schmallenberg virus in Germany. So when you see these animals, first thing you want to do is you want to do a very good analysis and post-mortem looking at the nervous system, particularly the spinal cord, for clues to a viral cause of arthrogryposis, but also look at the central nervous system of the brain, because many of these viruses will often cause significant developmental abnormalities in the brain as well, including hydranencephaly and porencephaly. Another cause of arthrogryposis are plant toxins. Anything that prevents the animal from extending and moving and flexing its legs during development can cause arthrogryposis. And so there is a particular plant known as ponderosa pine, which causes persistent uterine contractions. So the uterus is contracted all the time, and the poor developing fetus can't move its legs and ends up with significant abnormalities. Another plant toxin that will cause this is lupins. Usually this is flexion contracture of the forelimbs, resulting from a teratogen in lupines known as anagyrine. And anagyrine inhibits fetal movement. It has a sedative or sort of anesthetic effect. So the animal doesn't move and ends up with contracted limbs. It's not just a ruminant thing. You can see it in pigs as well. Arthrogryposis has also been known to be congenital in nature in ruminants as well as pigs. It's been seen in Yorkshire pigs. It's also been seen with exposure in pigs to a number of plants like thorn apples and tobacco stalks, and even nutritional deficiencies of manganese or vitamin A. So arthrogryposis is a syndrome with many different types of, many different causes, and obviously many different presentations. Another pig with arthrogryposis. So it looks like he's praying. Okay, this is known as crooked calf disease, although that has been applied to a lot of other conditions involving arthrogryposis. Congenital forms of arthrogryposis or crooked calf disease have been identified in a number of breeds of cattle, including Holsteins as seen here, also Charolais and Angus, and it's probably a multifactorial genetic disorder with a number of genes coming into play. These animals often have significant skeletal abnormalities within the vertebral cord. They often are scoliotic as well. So arthrogryposis, crooked calf, skeletal abnormalities, number of causes that need to be investigated. This is a very elegant looking sheep, a black-faced sheep, so either a Suffolks or Hampshires, with this sort of pronounced bowed nose. Some people call this a Roman nose. The condition is known as Arachnomelia or spider lamb's disease. The animals are extremely spindly. They have very long legs, often with valgus deformities, so they're sort of bowed, and they have a number of skeletal abnormalities, including significant defects in the spinal column. Spider lamb disease was first identified in New Zealand. Here's a picture of the legs of this animal. They get the name spider lamb because they have these very long legs that obviously reminded somebody of a spider. And as we mentioned earlier in the lecture, this is a defect in the receptor for fibroblast growth factor 3. I don't really know what 1 or 2 do. I do know that when we talk about chondrodystrophic breeds of dogs like dachshunds and basset hounds, they often have defects in fibroblast growth factor 4. But fibroblast growth factor 3 is a mutation that you need to know because of its involvement with spider lamb. Here is an example of the vertebral column defects that you might see in these animals. They may be kyphotic or significantly scoliotic. And this is a growth plate from a long bone of an affected animal. Now, fibroblast growth factor 3 acts as an inhibitor of chondrocyte proliferation and terminal differentiation. So it functions to restrict the proliferation of cartilage at the physis and is a limiter of skeletal elongation. What you see histologically in these particular animals is it almost seems like the growth plate goes off in many different directions, or in this small piece of tissue you have many different growth plates operating at once because the inhibition of chondrocyte proliferation is not there. You can see that the end plates of the vertebra in the scoliotic areas of the spinal column are also not going correctly. And this causes the deviation and the abnormality in shape of the affected vertebra. Okay, all of these things we've talked about having not enough something. Let's look at a couple of conditions, common conditions that you might have too much of a good thing. Can you count to 7? 1, 2, 3, 4, 5, 6, 7 toes on this cat. Great picture from Dr. Famke Effner from her time at Ohio State University, and there's nothing wrong with this cat, except it has too many toes. This is known as polydactyl cats. And polydactyl cats maybe first came to prominence in the house of Ernest Hemingway in the Florida Keys. And if you want to see polydactyl cats, you go down to his house, and he has all these cats running around with 6 and 7 toes. Well, somebody got the idea, those will make great pets. And so they started breeding these cats, and so now you can buy an American polydactyl cat with 6 or 7 toes. I don't know if you have to pay extra for 7 toes, but Americans, we love our birth defects. White German Shepherds, multiple-toed cats. What are the cats that have the little short munchkin cats with a little short and chondrodystroph? We love them. We will sell them if there is an issue. Remember, anything with albinism is a birth defect, and often is accompanied with other birth defects like deafness and anything related to defective neural tube migration. But boy, if an American breeder can find a market for a good birth defect, that's big money. Okay. More polydactyly. Here we are in a calf. That's 1 foot, 4 toes. That's a couple too many. This one just had 1 extra claw. Polydactyly is an inherited trait in various breeds of cattle. Usually you see it more on the forelimbs. Okay, sometimes you have fusion of the claws resulting in Syndactyly. In cattle, this is most often seen in Holsteins. Sometimes they just fuse here at the claw. at the third phalanx, or they may fuse all the way up and give the animal a single hoof like a horse. And this is seen in pigs, in a special breed of pig known as the Mule Foot Hog. And there's one place in the U.S., in the Midwest, that sells these Mule Foot Hogs, and they do quite well. They obviously have adapted to having a single claw. And it's a sort of a niche breed for people who like to have unusual hogs. Having too much of a good thing? This is a picture from Dr. Helen Ackland in her career when she was working on the teratogenic effects of albendazole. And it had all sorts of abnormalities of the feet and the digits in affected animals. These animals have 4, 5, even 6 toes. Teratogenic effect of drugs. Okay, let's look at a couple of things that, these are certainly not life-threatening. We're looking at the cross-section of a rib from a dog. And you can see that this is mid-rib. And there is a large area of growth plate, which is covering the outside of the rib, or one side of the rib. And you have primary spongiosa arising from it. It is remodeled. It's forming its own marrow cavity, which connects with the traditional marrow cavity of the rib. And this is known as a cartilaginous exostosis. It's a cartilaginous cap, which undergoes orderly endochondral ossification. The way these happen, and they show up as little bumps on the rib. As we can see here in a puppy with multiple cartilaginous exostoses. Generally, they don't cause much of a problem, except in certain locations, like maybe if you had one as part of the dorsal vertebral body. Here's one that unfortunately is growing and compressing on the spinal cord, but usually they don't cause any problems. They're just little cosmetic defects, little bumps. The owners will want to know what they are. So if we go back to the gross appearance, okay, what happens here is normally you have growth plates at opposite ends of the bone. And then they will grow, they will contribute to the longitudinal growth of the bone, and the bone will grow longer and longer, but every once in a while a little bit of it breaks off and is left behind. Usually it's found in the middle of the bone as the bone elongates, always from the ends, not from the middle. This is left to its own device, and nobody's told it that, hey, the growth plates are now inches away, so it continues to make bone like it's part of the growth plate, and you get these sort of knobby extensions off of various bones. Not life-threatening, and this will close when the rest of the physes close. So they don't grow for the animal's life. They will stop when the bones close, and then the animal will be left with some cutaneous defects. These are multiple cartilaginous exostoses. Some people will call them osteochondromas. It's a bad name, and that sort of confuses with the tumor process, especially in cats, which we're going to look at later on when we talk about tumors, that has a history of being virally induced. So I don't use the term osteochondromas for this, but if you get this on a biopsy and you don't have a history that this animal's doing just fine, it has these bumps on some of its long bones, you may think that this is a benign fibroosseous proliferative process. Okay, open fontanelles. These are very common cranial defect in a number of animal species. You can see it associated with other abnormalities in any of the ruminant species and congenital conditions that we've talked about before. This one happens to be an Angus, and it is well known to be a mutation in Angus cattle, especially with the progeny of a particular Angus bull called Precision 1680. Very popular sire, but he was throwing a lot of these calves. It was considered to be a spontaneous mutation in Precision 1680 himself. Basically, they've done away with his line, so we don't see this one much anymore. This can also be seen as a common finding in brachycephalic breeds of dogs, like Chihuahuas and Boston Terriers and all that. It often accompanies hydrocephalus. Hydrocephalus itself may predispose to this particular condition. A lot of small breed dogs with open fontanelles live a pretty significant life. Just don't poke them on top of the head. But there are also obvious pathologic abnormalities which are so often associated with other neural tube defects, in which you have protrusion of fluid-filled meninges or actual brain tissue through a hole in the top of the skull. These are known as meningoceles, if only the meninges and some fluid are in there, or encephaloceles. And they've been associated with a number of multifactorial congenital defects, syndromes in various animal species, not an uncommon defect. You can actually see defects in the central nervous system throughout the length of the skeleton, from the skull all the way down, as we see here in this lamb, to down near the tail. This is rachyschisis, or opening of the dorsal vertebral process, where you can look down and see the spinal tissue, or the spinal tissue is gone. Sometimes this one's very mild. It's just very photogenic. Another great picture by Dr. Famke Effner, where you can look down and see the musculature covering the spinal cord. In humans, this is referred to as spina bifida, and it is just a variant of, it's an accompanying defect associated with many neural tube defects. Always look for abnormalities in the underlying neural tissue as well as the musculoskeletal system. Here is a great lesion which has an equivalent in humans known as Caffey's disease, which is known as radio-ulnar hyperostosis in pigs. And it's seen in young piglets, and you have this tremendous proliferation of the periosteum of the radius and ulnar here. And if you didn't know that this was a young pig, you might initially look at this picture and say, oh, that's osteopetrosis, but most of the bone is fairly loosely arranged woven bone, which arises from the periosteum of the radius and ulna, resulting in atrophy of the overlying muscle and soft tissues and tremendous hyperemia in the live specimen. So there's a good picture of both and so you have these very enlarged limbs, sort of like Popeye, and there are it's a genetic problem. It's proven to be an autosomal recessive trait, although it hasn't been totally worked out as far as I know. There are a couple of theories that have been published as to why this occurs. One has identified disorganization of the perichondrial ossification groove of Ranvier. This is a membrane which surrounds the growth plate, enabling its expansion. The other theory is that this is a local circulatory disturbance of the median ulnar artery, which results in prolonged edema and subsequent periosteoreaction. So, a couple things out there, but radio-ulnar hyperostosis in pigs. Polydactyly, we've covered this in the GI tract. It is one of the most common congenital abnormalities across all animal species. And here are 3 animals with varying degrees of polydactyly. This occurs when you have a defective migration of the lateral palatine shelves to close the soft and hard palates. It is often associated with other abnormalities, including cleft lip. And in certain breeds of cattle, like Charolais, it may be associated with Arthrogryposis. There is a syndrome of Arthrogryposis and polydactyly, also known as SAP, in Charolais cattle. So very, very common. You'll see it depending on the size of the defect. It may or may not be consistent with life. Looking at some more focal defects that are just fun to look at, not associated with any viral abnormalities here. This is a bulldog, likely a French or an English bulldog, very classic lesion known as a butterfly vertebra or a hemivertebra, which has normal development on top, abnormal longitudinal growth at the bottom. They look like little butterflies, and you'll see these animals will be mildly kyphotic. Poultry often has growth defects of the vertebra. One of the most common is at T6. T6 is a place where a lot of things happen in birds, a place where you get a lot of abscesses, but you can have abnormalities of the vertebra at T6. The condition is known as spondylolisthesis or kinky back, and it's usually seen in young broilers between the ages of 3 to 6 weeks. And as you can see here, as this vertebra grows in its abnormal fashion, it results in spinal cord compression. It's probably aggravated by the rapid growth that we see today in broilers, which is the root cause of so many problems in the broiler industry, because we try and get them grown out to market as quickly as we can. Now we're down around 9 weeks to have a fully grown bird. So any type of skeletal abnormality is going to be aggravated by this rapid growth rate. We're going to talk about this later on. We talk about degenerative change. This is a condition known as epiphysial lysis. In dogs, you will see rupture of the ankylosing process, and it has to do with abnormalities of the ossification centers here, and the cartilage that is there does not develop properly and tends to break right through. Most often, as we said, most often seen in heavier animals, not seen in young animals like German Shepherds. Here, if you also look, besides the ununited ankylosing process, these probably unite, but the cartilage there is defective, and just weight bearing eventually causes fracture. You can see right here, there's another small fracture here, and that's the coronoid process. And these two often go together. Ununited ankylosing processes and fragmented coronoid processes are well described in dogs. Similar syndromes can also be seen in cats at the ischial tuberosity. Heavy neutered male cats will often pop off the heads of their femurs with a linear break through the pretty much histologically normal cartilage there. And they just hop up on the counter and they pop off the top of one of their femurs. And then you can also see this in pigs, especially heavy sows at the ischial tuberosity. They will break off the ossification center of the ischial tuberosity, where a lot of the major muscles of the hind legs anchor, and they'll go down from that. So it's a congenital defect. It's a defect in the cartilage. It's not a true fracture. It's a fracture through where the growth plate and the ossification center used to be. Here's another defect that you'll see a lot in brachycephalic dogs. The animals often have they show no problem throughout their lifetime. And you just notice this incidentally. One breed where it is well known is the Cavalier King Charles Spaniels, and this is, look at the abnormality of the shape of the foramen magnum. Normally all you should see is a small hole here. This is a very large one. This is referred to as a keyhole foramen magnum. And with the Cavalier King Charles Spaniels, it's often associated with syringomyelia and maybe associated with cerebellar coning or cerebellar herniation. Obviously, you can see that any damage to the brain or swelling, you have a large area where the cerebellum will protrude through this enlarged foramen magnum. Keyhole foramen magnum. We're going to see some other skull defects later on. We talk about nutrition that result in cerebellar coning, but this is, at least in the Cavalier King Charles Spaniels, the cerebellar coning is associated both with these abnormal foramen and fluid accumulation within the proximal spinal cord due to syringomyelia. Here's a condition in poultry that I wasn't sure exactly where to put it because so many things have been identified as causing this particular. So I threw it in congenital because I think, there's probably a genetic condition here. And you can see in the tibia of both chicken and turkeys, fast-growing birds, you often will have these large partial or communicating triangles of unremodeled cartilage. And the condition is known as tibial dyschondroplasia. You can see it in other long bones, but it's most commonly seen in the tibia. If you go to Popeyes or Kentucky Fried Chicken and you take your penknife and you start cutting up the drumsticks, you may run into something like this. And it's probably just another of so many diseases resulting from rapid growth rate. But it's been associated with toxins such as fusarium. It's been associated with nutritional abnormalities, low calcium phosphorus ratios. It's been associated with some pesticides, copper deficiency. So I put it in here. It's a great lesion. This is one that anytime you have chicken dinner, you have the opportunity to see it. A great lesion here of tibial dyschondroplasia. And tibial dyschondroplasia is a lack of remodeling of the chondrocytes in the prehypertrophic zone. It's a zone of proliferation. Normally they will proliferate, then they will get bigger, they will line up. At this point there is vascular invasion, but there's a defect at this point, so they never get to the zone of hypertrophy, and this zone of prehypertrophy continues to grow and grow. It is not always the entire growth plate. This one, it apparently is. But tibial dyschondroplasia, it's a great lesion. Everybody's got good pictures. It's a good one for an examination. So know a little bit about tibial dyschondroplasia. We'll probably mention it in some of the other lectures as we go along. Here's another, now we're into the muscles, and another genetic issue. I didn't know where else to put it, so I wanted to put it in here. We're looking at the haunches of a pig, and you can see that a lot of this muscle is sort of white. If you were going to touch it, it would be sort of edematous or oozy, and the condition is named porcine stress syndrome. It used to be called malignant hyperthermia due to some of the lesions that will be seen in some of the animals who would run very high fevers, especially if anesthetized. Also been called transport myopathy, probably having to do with the stress of transport. But this is a very complex genetically transmitted disease which has to do with abnormalities of the ryanodine receptor in the muscles. It's also been known as PSE. This one goes by a lot of names. I don't want to forget any. And PSE, sort of a terrible name. It's called pale, soft, and exudative pork. And that's not too bad if you want to know what the lesion looks like this. And what happens is here's a nice picture. The defective ryanodine receptor in times of stress or anesthesia, but mostly stress, will flood the sarcoplasm of the skeletal muscle with calcium. And it can't take it back up. So it leaves it there. So these muscles contract strongly because they're going to contract as long as calcium is there to cause actin and myosin to migrate along each other. So they're in tremendous contraction, and then you get necrosis of the muscle. You can tell the muscle is necrotic. Around here are areas of hemorrhage. This muscle is ischemic, it's necrotic, and it's almost like an infarct. So you have the hemorrhage and inflammatory cells trying to get in from around that. But this is the area. It looks sort of dry. It doesn't look moist like normal, healthy muscle. Just a great picture of this PSE pork. Nice picture by Kim Newkirk at the University of Tennessee. So, defective ryanodine receptors, I just put it in with the congenital. Some people say, well, it's a toxic change or something. Hey, we're going to cover it now. We're not going to talk about it in any of the lectures. That's PSE, pork, or porcine stress syndrome. Okay, a somewhat grossly related condition looks very similar. You can see these large areas of necrotic muscle in the hind limb musculature of a horse is a condition known as exertional rhabdomyolysis. Now, let's not confuse this with capture myopathy, because this is very particular. It affects the strongly glycolytic type 2B and type 2A muscles in the hind limbs of horses and predisposes them to compartment syndrome. This is has been known as Monday morning disease. It is a monophasic myopathy. There's no mineralization. Everything is pretty much, it happens, in a very short period of time. So all of the tissue is in equal areas of necrosis. Usually we see it in young female race horses, but you can see it in athletic horses worldwide. These fibers, these glycolytic fibers, are slow twitch fibers, usually seen in the gluteal, lumbar, and the femoral groups, and these animals become recumbent and may die. The inciting cause is almost always exercise, but the underlying causes are often not known, and these animals will release large amounts of myoglobin from the injured muscles, turning the urine dark and causing damage to the renal tubules. Myoglobinuria is significantly more damaging to the renal tubules than hemoglobin, and often results in acute tubular nephrosis, death of the lining tubular epithelium, and secondary obstruction. Monday morning disease, exertional rhabdomyolysis. Look at this bull. This is a Belgian blue, and these bulls sell for outrageous amounts of money because they are double muscled, maybe triple muscled. And the result, this double muscling results from a genetic defect in a protein which is known as myostatin. They have deficient myostatin production, and myostatin comes from the Latin myo meaning muscle and stat meaning stop. Okay, these muscles don't stop growing. Okay, and these animals, especially over the haunches and over the shoulders, get these tremendous amount of muscle with very little fat. Now that sounds like a really great thing to have. Very lean beef produced in very large amounts. Okay, one of the issues that you will see is that these animals are sort of prone to a lot of injuries, a lot of muscle ruptures, because in addition to not producing a lot of fat, the other connective tissues are not produced in high numbers. You can see this very simply when you go to the gym, and you'll see these weightlifters, and they're all muscle and all that, but they have to be very careful that they don't tear a muscle or they don't injure themselves, because you don't have, when your muscles get really big and hypertrophic, the only thing that gets big are the muscle fibers, so you don't have the connective tissue that will back it up. So these are Belgian blue, and they are known for their double muscling. There is another popular, once again, Americans love their defects. So there is a breed of Whippet known as the Bully Whippet. Has a similar, don't know if it's a similar genetic defect, but they have these tremendous muscles on this tiny frame, and they look sort of really bizarre. They look like odd, pointy-nosed pit bulls. So if you ever get a chance to Google them, Google Bully Whippet. Always fun to look at. Okay. With that, I think we have covered the congenital diseases of the musculoskeletal system, at least from my perspective and from my slide collection. We didn't cover them all, but that's why I call these selected gross pathology. And we will cover a number of these conditions again, briefly, in other lectures, because so many of these congenital conditions may also be nutritionally based, or have other causes. So, hope you enjoyed this. I really enjoyed it. It's my first time back from a couple of weeks off, and it's always good to get back in front of the computer and the microphone. Hey, I thank you so much for tuning in to wherever you got this video from, whether it's from the Joint Pathology's video library, Joint Pathology Center's video library, from the Foundation's Facebook page, or our YouTube channel. And I hope you'll come back in our next lecture, which will be much shorter, I promise. We're going to talk about viral diseases that affect the bones. I hope everybody has a great day.